Welcome to our comprehensive guide on analgesics and anesthetics. Pain is a universal experience, and managing it effectively is crucial for well-being. In this video, we'll explore the essential differences between analgesics and anesthetics, how they work, and their roles in medicine. Whether you're curious about over-the-counter painkillers or want to understand how anesthesia makes surgery possible, you're in the right place. Let's start by defining what pain is and why it matters so much in healthcare. Understanding pain management is the first step to appreciating the science behind these important medications. Analgesics are medications designed specifically to relieve pain without causing loss of consciousness. They are among the most commonly used drugs worldwide, helping people manage everything from headaches to chronic pain conditions. Analgesics work by blocking pain signals in the nervous system or by interfering with the brain's interpretation of those signals. There are several types of analgesics, each suited to different kinds and intensities of pain. In the next scenes, we'll break down the main categories and how they function. Analgesics can be broadly classified into two main categories: non-opioid and opioid analgesics. Non-opioids include familiar drugs like acetaminophen and non-steroidal anti-inflammatory drugs, NSAIDs such as ibuprofen. Opioid analgesics, on the other hand, are stronger medications used for more severe pain, often prescribed after surgery or for cancer pain. Each type has its own mechanism of action, benefits, and potential side effects. Choosing the right analgesic depends on the type and severity of pain, as well as individual patient factors. Non-opioid analgesics are the first line of defense against mild to moderate pain. Acetaminophen is widely used for headaches and minor aches, while NSAIDs like ibuprofen and aspirin are effective for pain with inflammation, such as arthritis or muscle injuries. These medications are available over the counter and are generally safe when used as directed. However, overuse can lead to side effects like stomach irritation or liver damage, so it's important to follow dosing instructions carefully. Opioid analgesics are powerful pain relievers reserved for moderate to severe pain, such as after major surgery or in cancer care. Common opioids include morphine, oxycodone, and fentanyl. These drugs work by binding to opioid receptors in the brain and spinal cord, blocking pain signals effectively. However, opioids come with significant risks, including dependence, tolerance, and potential for overdose. That's why they are prescribed with caution and under strict medical supervision. Analgesics relieve pain by targeting different parts of the pain pathway. Non-opioids like NSAIDs reduce inflammation and block enzymes that produce pain signals. Acetaminophen works mainly in the brain to lower pain perception. Opioids, meanwhile, attach to specific receptors in the nervous system, blocking pain messages from reaching the brain. Understanding these mechanisms helps explain why certain analgesics are chosen for specific types of pain. Like all medications, analgesics can cause side effects. Non-opioids may lead to stomach upset, ulcers, or liver issues if overused. Opioids can cause drowsiness, constipation, nausea, and most seriously, addiction or overdose. It's important to use these medications as directed and to consult a healthcare provider if you experience any concerning symptoms. Awareness of side effects ensures safer pain management for everyone. Anesthetics are drugs that cause a reversible loss of sensation or consciousness. Unlike analgesics, which relieve pain, anesthetics are used to block all sensations, making medical procedures possible without discomfort. There are different types of anesthetics, each suited to specific procedures and patient needs. In the following scenes, we'll explore the main categories and how they are used in healthcare. Anesthetics are generally divided into local, regional, and general anesthetics. Local anesthetics numb a small area, regional anesthetics block sensation in a larger part of the body, and general anesthetics induce unconsciousness for major surgeries. Each type has unique uses, benefits, and risks. The choice depends on the procedure, patient health, and desired effect. Let's look at each type in more detail. Local anesthetics are used to numb a small, specific area of the body. They are commonly used for minor procedures like dental work or stitching a cut. Drugs like lidocaine and bupivacaine block nerve signals in the targeted area, allowing patients to remain awake and comfortable during the procedure. Local anesthetics are generally safe with few side effects when administered properly. Regional anesthetics block sensation in a larger part of the body, such as an arm, leg, or the lower half of the body. Examples include epidural anesthesia, often used during childbirth, and spinal anesthesia for lower body surgeries. These drugs are injected near major nerves or the spinal cord, providing pain relief without affecting consciousness. Regional anesthesia is a valuable tool for many surgical and pain management situations. General anesthetics are used to induce complete unconsciousness for major surgeries. These drugs are administered through inhalation or intravenous injection and affect the entire body. Common agents include propofol, sevoflurane, and nitrous oxide. General anesthesia ensures that patients feel no pain and have no memory of the procedure. However, it requires careful monitoring due to potential risks like breathing problems or changes in blood pressure. Anesthetics work by interrupting nerve signals in the body. Local and regional anesthetics block nerve conduction in specific areas, while general anesthetics affect the brain and central nervous system to induce unconsciousness. The exact mechanisms can vary, but all anesthetics prevent the brain from processing pain and other sensations during procedures. This makes surgery and other interventions possible without distress. Anesthetics, like all medications, can cause side effects. Local anesthetics may cause temporary numbness or tingling. Regional anesthetics can sometimes lead to headaches or low blood pressure. General anesthetics carry risks such as nausea, sore throat, confusion, or rarely serious complications like allergic reactions. Anesthesia teams monitor patients closely to minimize risks and ensure safety throughout procedures. It's important to distinguish between analgesics and anesthetics. Analgesics relieve pain without affecting consciousness, making them suitable for everyday pain management. Anesthetics, on the other hand, block all sensations and may induce unconsciousness, allowing for pain-free medical procedures. Both play vital roles in healthcare, but they are used in different situations and have distinct effects on the body. Analgesics are used for a wide range of conditions, from headaches and muscle aches to post-surgical pain and chronic illnesses like arthritis. They are often the first choice for managing mild to moderate pain and are available in various forms including tablets, capsules, creams, and patches. Their accessibility and effectiveness make them a staple in both home and hospital settings. Anesthetics are primarily used during medical and dental procedures to prevent pain and discomfort. Local anesthetics are common in minor surgeries and dental work, while regional and general anesthetics are essential for more invasive operations. Their use allows patients to undergo necessary treatments safely and comfortably, making modern medicine's advances possible. Many analgesics are available over the counter, making them accessible for self-care. Common examples include acetaminophen, ibuprofen, and aspirin. These medications are effective for everyday aches and pains, but it's important to use them responsibly and follow dosing guidelines. Overuse or misuse can lead to side effects or complications, so always read labels and consult a pharmacist if unsure. Some analgesics, especially opioids and certain NSAIDs, require a prescription due to their strength and potential risks. Doctors carefully consider the type and amount of medication needed, balancing pain relief with safety. Prescription analgesics are often used for severe pain, post-surgical recovery, or chronic conditions that don't respond to over-the-counter options. Analgesics can be taken in various forms, including oral tablets, topical creams, patches, or even injections. The method of administration depends on the type of pain, its location, and patient preferences. For example, topical creams are great for localized muscle pain, while oral tablets are convenient for general aches. In hospitals, injections may be used for rapid pain relief. Anesthetics are administered in several ways depending on the type and procedure. Local anesthetics are injected or applied directly to the area. Regional anesthetics are injected near nerves or the spinal cord. General anesthetics are given through inhalation or intravenous injection. Anesthesia teams carefully monitor patients to ensure the correct dose and minimize risks. Both analgesics and anesthetics must be used safely to avoid complications. Always follow dosing instructions and inform your healthcare provider about any allergies or other medications you're taking. For anesthetics, medical professionals monitor vital signs and adjust doses as needed. For analgesics, avoid exceeding recommended doses and be aware of possible interactions with other drugs. Certain groups, such as children, pregnant women, and the elderly, require special consideration when using analgesics or anesthetics. Dosages may need adjustment, and some drugs may be avoided altogether. Healthcare providers assess each patient's unique needs to ensure safe and effective pain management or anesthesia during procedures. Effective pain management starts with proper pain assessment. Healthcare providers use scales and questionnaires to understand the intensity, location, and nature of pain. This information guides the choice of analgesic or anesthetic and helps tailor treatment to each patient's needs. Accurate assessment is key to successful pain relief. Chronic pain lasting longer than 3 months often requires a different approach than acute pain. Analgesics may be used alongside physical therapy, counseling, or other treatments. The goal is to improve quality of life and function, not just to eliminate pain. Chronic pain management is a complex, ongoing process that often involves a team of healthcare professionals. Acute pain is sudden and usually short-lived, often resulting from injury or surgery. Analgesics are the mainstay of treatment, providing quick relief and aiding recovery. The choice of medication depends on the pain's cause and severity. Acute pain management focuses on comfort and supporting the healing process. Pain signals travel from the site of injury through nerves to the spinal cord and brain. Analgesics and anesthetics work by interrupting these pathways at different points. Understanding pain pathways helps explain why some drugs are more effective for certain types of pain and guides treatment choices. With repeated use, especially of opioid analgesics, the body can develop tolerance, requiring higher doses for the same effect. Dependence may also occur, leading to withdrawal symptoms if the drug is stopped suddenly. These risks highlight the importance of careful prescribing and monitoring by healthcare professionals. Opioid analgesics carry a risk of addiction and misuse, which has become a significant public health concern. Addiction is a complex condition involving psychological and physical dependence. Safe prescribing practices, patient education, and monitoring are essential to minimize these risks and ensure responsible use of pain medications. Not all pain relief relies on medication. Non-drug methods like physical therapy, massage, acupuncture, and relaxation techniques can be effective, especially for chronic pain. Combining these approaches with analgesics can enhance pain control and reduce the need for higher doses of medication. Educating patients about the safe use of analgesics and anesthetics is crucial. Understanding how and when to take medications, recognizing side effects, and knowing when to seek help can prevent complications. Healthcare providers play a key role in ensuring patients are informed and empowered to manage their pain safely. Pharmacists are valuable resources for information about analgesics and anesthetics. They can answer questions about dosing, interactions, and side effects, and help patients choose appropriate over-the-counter options. Pharmacists also work with doctors to ensure safe and effective medication use. Anesthesiologists are medical doctors specializing in anesthesia and pain management. They assess patients before procedures, choose the right anesthetic, monitor vital signs during surgery, and manage recovery. Their expertise ensures that anesthesia is safe and effective for every patient. Advances in medicine have led to new pain management options, including targeted drug delivery, nerve blocks, and minimally invasive procedures. Research continues to improve the safety and effectiveness of both analgesics and anesthetics, offering hope for better pain control in the future. Some patients may use alternative or complementary analgesics such as herbal remedies or supplements. While some options may provide relief, it's important to discuss these with a healthcare provider to ensure safety and avoid interactions with other medications. Allergic reactions to analgesics or anesthetics are rare but possible. Symptoms can include rash, swelling, difficulty breathing, or anaphylaxis. Immediate medical attention is required if an allergic reaction is suspected. Always inform your healthcare team about any known allergies before receiving medication. Analgesics and anesthetics can interact with other medications, potentially causing harmful effects. Always provide a complete list of your medications to your healthcare provider. Pharmacists and doctors can help identify and manage potential interactions to keep you safe. During anesthesia, patients are closely monitored for vital signs like heart rate, blood pressure, and oxygen levels. This ensures that the anesthetic is working properly and that any complications are detected early. Monitoring is a critical part of safe anesthesia care. After a procedure, patients are monitored as the effects of anesthesia wear off. Recovery times vary depending on the type of anesthetic used and the individual's health. Most people experience some grogginess or mild side effects, but serious complications are rare with proper care. Pain management is a key part of surgical care. Anesthetics are used during the procedure, and analgesics are often given afterward to control post-surgical pain. The combination ensures patient comfort and supports a smooth recovery process. Dentists use both analgesics and anesthetics to manage pain during and after dental procedures. Local anesthetics numb the area for fillings or extractions, while analgesics help with post-procedure discomfort. Effective pain control makes dental care more comfortable and less stressful for patients. Children require special attention when it comes to pain management. Dosages must be carefully calculated, and certain medications may not be suitable. Both analgesics and anesthetics are used with caution, and non-drug methods are often included to ensure comfort and safety. The future of pain management is promising, with ongoing research into new drugs, delivery systems, and personalized medicine. Scientists are exploring ways to target pain more precisely and reduce side effects. Advances in technology and understanding of pain pathways will continue to improve patient care. Sum up, analgesics and anesthetics are essential tools in modern medicine. Analgesics relieve pain without affecting consciousness, while anesthetics block sensation and may induce unconsciousness for procedures. Both have unique uses, benefits, and risks. Safe use, patient education, and ongoing research are key to effective pain management now and in the future. Thank you for joining us on this journey through the world of analgesics and anesthetics. We hope this video has helped you understand the differences, uses, and importance of these medications in healthcare. Remember, always consult a healthcare professional for advice on pain management and medication use. Stay informed and take care of your health.